And now to the latest on the fight against COVID-19. China is going through its worst outbreak of COVID-19 since the beginning of the pandemic, as cases spike and lockdowns are brought back into cities like Beijing and Shanghai. Dr. Ali Raja joins us now. He's the executive vice chair of the Department of Emergency Medicine at Massachusetts General Hospital and an associate professor of medicine at Harvard Medical School. Doctor, always great to have you with us. So let's just start with that. I mean, is this a sign of what's to come? And why do these lockdowns seem to not really be working?
It's a great question, Savannah. First of all, I don't know that it's a sign of things to come for the U.S. and other really populous countries. The fact is, when we think about Beijing, we're talking about 22 million people, Shanghai, 25 million people. That's 3 times the size of New York City. The setups in Beijing and in Shanghai that have led to Shanghai being locked down are not things that we can replicate around the country or around the world. The other thing is that the fact is that we don't quite know that the lockdown in Shanghai has been as effective. It was implemented a little late, about a month after they had already seen the rise. And so if you're going to implement something like that, it really needs to be done earlier. What I'm hopeful will work is what Beijing's actually doing right now. Over the next few days, between today, Tuesday, and Saturday, they're going to hope to test almost everyone in the city, 20 million people out of the 22, hoping to prevent the kind of lockdown that Shanghai was faced with recently.
Yeah. Now, Doctor, this outbreak in China that we're discussing comes as a report from the New York Times, highlights low vaccination rates among some of the world's most underdeveloped countries. As long as these populations are waiting for a vaccine, we talk about this being this global disease. Are new variants and global waves going to continue?
I think so, Savannah, and it's really tragic. The fact is that even though we know this is a global disease, we tend to focus and put on blinders and focus on the local. And in the U.S., for example, we've got about between 2/3 and 70% of our population vaccinated. And many of the richest countries of the world are about there, between 60 and 70% or even more. The problem is that many of the poorest countries of the world are under 20%. The continent of Africa as a whole is less than 17% vaccinated. And what we tend to forget, because we're focusing on other crises, is that that's exactly what you noted, is that that's where the variants are going to develop in places that don't have high vaccination rates. And they will spread around the world. So we really need to refocus both our energy and our funding on trying to get as much of the whole world vaccinated, not just our own local cities, states, and countries.
And Doctor, back here at home, though, we have seen cases in the U.S. rise in the past several weeks, but deaths from COVID infections have remained in a downtrend. I see that. I think that's good news. Is that right? Are these encouraging trends?
It is. It's absolutely good news, Savannah. I was working a shift yesterday in the emergency department, and I had a few patients come in after testing positive for COVID at home, or who came in with vague symptoms and tested positive with me. But most of them, actually all of them yesterday, were able to go home. And that's really good news that the people who are testing positive are vaccinated and going home. But what we're seeing is as mask mandates come down with public transportation, and we don't have kids yet who are vaccinated under the age of 5, we're not at all out of the woods. And so I love the fact that right now the current variants that we're seeing aren't hospitalizing people, but we don't know what the next variants are going to do. And so it's still really important to try to get everybody vaccinated.
All right, Doctor, thank you so much. Good to see you. We appreciate your time this morning.
Thanks, Savannah.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.